This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com. By now, we all know the number one cause of chronic and intractable health conditions is inflammation. Inflammation causes a decreased immune response that can lead to cancer, cardiovascular disease, insulin resistance, and degenerative loss of muscle and bone. But did you know the number one cause of chronic inflammation is lack of sleep? Multiple studies have concluded that stress, short sleep cycles, hormone imbalance, low blood sugar, chronic pain, and environmental issues like ambient light cause most sleep disturbances. However, according to a recent study, natural sleep at the same time every night is the secret to restoring health and increasing longevity. So what can you do? Sleep in a black, cool room. Don't drink any liquids for an hour before bedtime. Eat small amounts of protein before retiring. Cover your digital clock and never go to bed hungry.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com. Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series Video on Demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Breathe clean filtered air with an Air Tamer Personal Air Purifier. It's easy to have filtered air with an Air Tamer Personal Air Purifier. An Air Tamer Personal Air Purifier emits healthy negative ions to push airborne pollutants away from your breathing space. It's purified air wherever you go. The Air Tamer Personal Air Purifier reduces viruses by 99% within 20 minutes. Go to drtomroselle.com/products to get an Air Tamer Personal Air Purifier. For a limited time, use the coupon code Roselle and get a 20% discount and free shipping. Order today.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Are you suffering from flu-like symptoms? Get relief from muscle and body aches, headache, chills and fever, cough and congestion with Oleander 4X. Oleander 4X, made from oleander extract, is a tincture that provides relief for flu-like symptoms. Get relief with Oleander 4X. Go to drtomroselle.com/products to get Oleander 4X today. For a limited time, use the coupon code Ageless Health and get a 10% discount. Order today.
information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome to a new pod stream, live stream, right after the radio program on WMAL. This is going to be a lot of fun, and we're looking forward to bringing you a lot of controversial topics, things that you need to know about. We're going to have guests that have pieces of information that are really not readily available. And as we bring them in over a period of time, you're going to learn about different subjects of how the body's immunological system really works, which is going to be the topic that we're going to discuss on quite in depth today. And this Wednesday evening, I have the pleasure of being with Dr. Scott Lamp, who will be my guest today on live stream. And we're going to get into the intimacies, but over a period of time, we're going to get people who have bandwidths from child advocacy and things along the nature of emotional problems. We're going to talk about how to really support a healing process in your body. We're going to talk about how we get succumbed and sucked into some misinformation, and we're going to have that data for you. It's going to be fun. It's going to be an interesting program, and we're going to try to develop it more and more over the months and hopefully years that we're going to be doing this for you. And really, that's the reason that we do this. It's for you. So today I want to talk about the immunological pathways, how they work a little bit. We want to talk about this COVID vaccine quite a bit, and I want to talk about the things that you can do to protect yourself. And it's important that you understand that. Over the last 4 years, I had a lot of finger pointing and things that I was saying and so forth that ultimately I was proven correct, and gotten little problems with a couple of the medical boards, and they wanted to come after and look at everything that I was doing. And fortunately, I was right, and I had the documentation, and I knew exactly where to find it and to show them that there's really two pieces of the puzzle, and we were only getting one very small molecule of what was out there, but there was an agenda, which many of you know about now. And we'll talk about what that agenda is. And anything that I say to you, I will have background, I'll have documentation for. But having said that, I'd like to get into the meat of the program. I'd like to introduce you to someone who I have a tremendous amount of respect for, someone who is amazing in their bandwidth intellectually, their capacity to really put things on the firing line. Anyway, having said that, Dr. Scott Lamp, welcome, my friend. Good to see you today.
Well, Tom, good to see you this afternoon. So this is kind of a little different experience, but let's get forth.
It is. It's different than what we've done over a period of years. And, I've been on radio for 25 years, and then we decided, hey, listen, we might as well join the modern age and start doing things that everybody else seems to want to have at their disposal. And what better than, a click of a button to hear all the things that all of us have to say. Scott, listen, we've gone into a time frame that I never thought I would see. And obviously I've been on the planet a little longer than you have. But there are things that are out there now that are being used, in my opinion, to structure, to manipulate for specific agendas. And I'm not going to get into that in today's program. But let's start talking first a little bit about this this COVID virus that's out there. Let's talk a little bit about what it is and what it really isn't, and then we'll kind of walk down through those weeds a bit, and we'll go back and forth. You and I have dealt with it probably at a much greater level than most physicians have. We're dealing with long haulers. We're dealing with people who have been exposed to other situations, and we're seeing the expression of those viral things from Epstein-Barr, cytomegalovirus, herpes reactions, and seems to be all kinds of cancers that are showing up as well. So my question, just for definition, Scott, what really is this thing that we've been dealing with, and why is it so persistent?
Well, I think it's a manufacturing thing. The key thing is probably the spike protein part of it. Seems to be like a catalyst that likes to hook on to different types of viruses, influenza, for example. and it enhances that and gets it across the barrier into us more. And that's the thing that's about it. It's not just only influenzas. It seems like it also stimulates other viruses to come to life where they've been dormant for a while, and all of a sudden now they start showing up. And even other things like even mRNA, these things are crossing across barriers, are affecting different organ systems. So it gets across the organ system. So then we have this huge mass of different type of problems that people are having. I mean, obviously you've heard some things in regards to the heart problems and the vascular issues, but the female issues and neuropathies and some of these other things that are happening, they're being transferred. And, the thing that always gets me with this is how much time do you really need to study something, or are you just going to push something through because there's some type of financial benefit on the other side of it?
Well, that's the key. There were so many different things at the onset of this craziness that could have worked and could have worked well. Monoclonal antibodies was proven to be extremely effective. Hydroxychloroquine with zinc, and I've said many times in the program, the hydroxychloroquine acts as an iontopher to pull the zinc into the system, meaning that it grabs a hold of it, decreases the inflammatory reaction around the cells so the zinc could go in. So what does that do? It decreases the ability of the virus to duplicate itself. Things like hypericum, St. John's wort. There's a host of things, but the oleander plant,
Right.
As you know, oleander is a product that was produced during COVID by a company called Phoenix Biotechnology out of Houston, Texas, and it was shown to dramatically stop the replication of the COVID virus basically within about 24 to 30 hours. And it could happen for a couple hundred bucks. So there goes all the money that was going into pockets because of the ventilators and the hospitalizations and the diagnostics and so forth. It was a scam as far as I was concerned. But look, at the end of the day, there's ways of getting around this thing. But and I think you're familiar with the study that came out of Saudi Arabia that showed that people who were vaccinated began to have, as you said a minute ago, a further expression of underlying dormant viral patterns that our body should be able to hang into. The Epstein-Barr viruses, the cytomegalovirus, the herpetic patterns, and so forth. We have an innate and we have an acquired immune system. What does that really mean, so people can understand that?
Well, I think the thing is innate system is like how your body normally gets something and how you process it. One of the things since we're talking about immune system, I'm just going to go off subject just slightly, is that basically our body needs to be challenged. And I think we talk about when we exercise, we build up our muscles, we break them down, we bring them back up again. And if we don't work our immune system, or if I have a fight on the immune system, we don't have a chance to bring it up. So that innate aspect of our body to do that. I mean, it's interesting to see when you're always amazed by people's immune system is looking at a kindergarten teacher and how they handle all these kids are coming in with all these different colds and things like that. And they seem to improve their immune system because they get exposure to it. Now, the problem being is when I get exposed, I get through my nose, I touch it through my skin, I get it through my mouth, I get it through my eyes. This passive type thing with the shot, you go past and you pass those mechanisms, and we're still trying to figure out why does it seem to have this thing when you bypass the regular body, it doesn't seem to work as well when the body does it. Then somebody else goes through and you do a passive type immunity type thing by pushing a needle through your skin and putting it right into the system. It's almost like a shock.
The interesting thing, the advertising that's out there, most of your drugs today are what they call biologicals. And what a biological simply is something that suppresses immunological responses so you don't have the symptom. For example, there's a drug out there for psoriasis, and they said, you can get mostly clear within so many months. But the reason it does that and how it works, it suppresses the body's immunological reaction, but further suppressing all immune reactions within the system at the same time. That's the problem. That's what a biologic is. And whether it's for rheumatoid and so forth, it allows the patient to be able to live with the disease process. But meanwhile, they become much more susceptible to other things that are around them. And, the shingles vaccine is another one. And we've talked about that repetitively where, they said if you've ever had chickenpox, you have the virus that will cause shingles. So go get your vaccine today. Well, they're giving you the same virus, the same vaccine that
Absolutely.
that aligns with the chickenpox. So, and the interesting piece that they don't tell you about is that the number of people who get shingles is equal to those who are vaccinated and not vaccinated. And those who are doing very well without the vaccine, now they get the vaccine, and sometimes that overwhelms them, and now they express it as, guess what, shingles. So
Yeah, younger people are getting it then because of what happens to getting the shot. The immunity on this thing is supposed to be like how many times you need a booster. The immunity from, let's say, natural immunity is going to be 60, 70 years. So, that's where the game is played. There's more money to be put into the aspect of getting the shot. And then all of a sudden now, like you said, you increase the amount of load on the body. And the next thing you know, I've got the problem. And I thought, wait a minute, I thought this vaccine is supposed to be stopping this.
I talked a little bit about the vaccine, the COVID vaccine, on the radio program today, and there's the inventor of the vaccine is a guy by the name of Dr. Robert Malone, and that poor guy has been ostracized for having the audacity to say this vaccine doesn't work, and he was the guy that created it. As far as what's out there, Scott, what do you know about why the vaccine is causing people to be more susceptible to, and also causing problems? You talked about the spike protein, and it locks into the cellular tissue and so forth. But how is that immune system being suppressed? How is that mRNA vaccine working to suppress body's immunological reaction to other viral patterns?
I think it's just making things more available to go across the membrane barriers. I think a lot of this stuff that we're working on is when you're looking at overall health and the immune system is how is that membrane barrier? And I think the mRNA just takes things across the barrier where they're saying, no, it's supposed to be isolated to certain points. No, it seems to be going across everything. And I think since that, it just leads itself to spread more and more and more and bring out other possibilities on the person. And then, of course, there's the underlying aspect of how good is the person's immune system in the first place. And then you added that on top of it, it creates a mess.
Scott, you've seen people walk into your practice that are fully masked up now. All of a sudden, the fear pattern is getting back in. People are stepping away from each other and so forth. And I said earlier on the program today that the reason that we have so many problems is always this time of the year, if you will. It's the colds, it's the flus, it's the side infections, the bacterial patterns, besides COVID. So, and then, the RSV, pulmonary problem that we have and so forth. All of those things are out there, and there's been others repetitively over a period of year. So my question to you is, these things are always there. They don't just show up. Why now instead of other parts, other times?
Well, I think there's a lot of different things that could play into this. I mean, when you talk about the overall aspect of the immune system we have different surveys we put in for like when people come to our office. And one of the things that's interesting, the one survey I like using, it goes through every system of the body. There's about 16 different parts to it. The very last part of it is the immune system. And it's like, well, that's not because it's last. It's because it's dependent on everything in front of it. And that means that how's your digestion? Are you breaking things down? And that's part of the immune system. You're going to need the minerals and nutrition that needs to go in there. So now our food supply is being somewhat altered. We're not eating the best foods and things like that. So that can be something we're not even breaking down. Even the thought process of having some type of acid in the system, in our digestive system, actually kills bacteria and viruses. This is one of the immune system to keep that from happening. And we have a huge amount of anti-acids that are out there. And then you go into gallbladder and liver and all these things that have within inflammation and allergies and things to foods that have been indoctrinated with different types of pieces. I mean, we got some type of like Frankenstein vegetables that we have out there that the body doesn't know quite how to handle. So it makes the system not smooth. It just makes it more harder to work with. And what I'm talking about when I talk about the survey, it's kind of like an assembly line. If I start off in the first part, I'm doing everything right, but now I got all these things screwing up in the middle. At the end, my immune system will be compromised. And so that's the thing is like all these different systems. Oh, am I getting minerals? Am I getting essential fatty acids? Am I getting all these things that have to be there to make things work? And it's interesting here in that same kind of line of thinking. Number 9 on the list is the adrenal gland. The hormones need all this stuff ahead of time to make sure these things are working. And we're getting in our way that we're indoctrinating foods. We're getting other chemicals that we're being exposed to. Lord knows we start getting into EMFs and all these kind of things. There's all these things that seem to alter what our normal circumstances are, and we have to fight harder to get those things back in place. And we need to almost seem to be more things like, as we looked at going back 20 to 30, 40 years and working on patients, it's a lot harder to take care of because things are changing in our environment and usually not in a good way.
Now, immunological problems are awful today. I mean, years ago, it wasn't uncommon to have somebody come in and you worked a miracle. It was only because the body was in a better place to receive the therapies and was able to express itself in a health performer much more so than they are today. But the other piece I was hoping that you'd bring out is why this time of the year seems to be worse than any other time of the year. One is because of sunlight in this part of the world. There's no vitamin D production. And
absolutely. I think vitamin D and some of those elements too that we look at when they have a change of weather. And are we doing things to kind of balance ourselves out? Going with the vitamin D, like you said, extremely important, especially with COVID. When we look at vitamin D, I kind of look at. We had this conversation before. I call it like Judge Judy. It's like you go to the courtroom. Judge Judy has to control the courtroom. The plaintiff and the defendant, if they go crazy, the thing goes nuts. And so to make the court system go correctly, in this case, the analogy is the immune system to improve. She has to be in there and make sure things are not too crazy one way or the other. And that's one of the things when you have things like terms like the cytokine storm that goes through and makes one side of the inflammatory process really terrible. It's like one side of the courtroom going crazy. And you've got to control that as it goes through. And vitamin D plays that part. I think when going back to I think it was 2021, and I think it was looking at Guyana where they had something like over 40 million people that are there. What was interesting when you were talking about before with hydroxychloroquine, because it was a malaria drug, they're on the equator. You know how many people in that group at the time was looking at, guess how many people who actually died of COVID at that time? 19.
Yeah, I know. It's right. Crazy, right?
It's ridiculous. And why? Because everything we're talking about proves the vitamin D. The vitamin D is up. It's strong. It's able to maintain those things. So there's a lot of things like that that are kind of interesting to see that somebody just doesn't want to take a look at it because it's cheap.
No, there's so many things out there that would help. I mean, we could get into the ivermectin and we could get into all those other pieces of the puzzle. They all had a tremendous impact. And so many, I was reading an article the other day that was published in NIH PubMed, and it was saying that the real number that was attributed directly to COVID, and the lie, if you will, that was being perpetuated, obviously there was a reason behind it. I'll let people draw their own conclusions. But they were saying that approximately it was about a third of the reported numbers that actually died from the sequela of advanced COVID. They killed people. Again, that's my terminology because of the ventilators. They put somebody up, they ruptured the alveoli sacs, they would go into septic shock and the body would shut down. There was a lot of reasons for that. Scott, I want to get into the masking just a little bit because, we're seeing more and more people mask up right now. And we're going to set aside, we're going to put it in two different categories, three actually. One, we're going to talk about the regular surgical mask that everybody wants to grab and wear. The second is we'll talk about the N95s. And then the third, we're going to talk about, the ventilators, if you will, that people have as, they come in and they have filters on both sides and so forth. Let's take the first one, which is what everybody goes out and grabs, the blue surgical mask. Yeah. Effective or not effective, and why?
Well, first off, the size of the filtration is not filtering anything. I mean, it's kind of like what's the old thing they talk about, a mosquito and a wire link fence that it's not letting the things fly right through. So the size is not going to make a difference. Or the size makes a difference. The virus is too small, so it goes right through it.
The piece you go into the N95, it really doesn't. Those masks were designed to keep heavy bacteria out of a surgical wound in an operation. the N95 masks, if they seal around the face, only if they seal around the face, if you wear them for an hour, because they do filter substantially in most situations, unless you directly sneeze into the mask, if you will. If you have a viral pattern, it's pushing it in. You become more of an incubator. It also decreases the oxygen potential to the tissue. Your oxygenation saturation level drops like a rock. So it's going to affect your brain. It's going to affect your heart. It's going to affect transport within the system. That's known. So here you are, what do? You isolate yourself? I don't think so. I think you bring up your immune response. And then the other ones, the ventilators, you're walking.
The other thing that never seems to be talked about is the aspect of how do you detox?
Yes.
I mean, for an individual to detox, you're supposed to be, one of the things that's through your skin, the fecal matter, the urine, but the other one's through your breath. So all you're doing is bringing things out and sucking it back in again. So your overall immune system is going to be hammered a little bit because it's not normally doing that. It's not supposed to happen. No. So then am I bringing things I'm pushing out that I'm sucking back in and I can't get rid of? Doesn't make sense.
The interesting paradigm is that, you read the articles that are out there. You go, effectiveness of COVID vaccines, and you're going to get stuff all over. And if you look at the traditional press, you're going to say, oh my God, I got to go get my vaccine. The problem is, and we've seen in our practice, is that these people that are coming in who've had, and so the first question I ask any new patient anymore, were you vaccinated? And they look at me, what are you talking about? I mean, were you vaxxed, COVID vaxxed? Did you get any of the boosters and so forth? And I start looking at them a little differently. And the thing that we're seeing, and I know you have, is that people who have been vaxxed and have been repetitively exposed to COVID virus, it's going to be out there forever for the rest of our lives. It's just like the flu. It's going to mutate on a regular basis, ongoing. It's not something that is going to go away, but it becomes less problematic. The thing that is it locks itself into three major areas, at least what I've been finding. Is one is the brainstem and the cerebellar area. The other one is the heart and heart-lung area, and the other one is the mesenteric apron, or the lymphatic chain that sits over the intestinal tract. And as we said, that's your primary immune response. What are you seeing with your patients?
I'm seeing a similar thing. And I think, I remember looking at something, I think it was Dr. Angus Dalglish, who was a professor in oncology in London. And one of the things she talked about is SARS-CoV-2 or spike protein. What it does after, especially with booster, it obliterates the repair mechanism in the lymphocytes. Now, what lymphocytes are things that kill viruses. Well, wait a minute. Isn't that what we're supposed to be doing? It's kind of an interesting aspect, the same type of thing. I've seen a lot of heart type things, myocarditis type elements, maybe some neuropathies also associated with the neurological component. And I think it's interesting when you're talking about the midbrain area of the brain seems to be affected considerably with this.
It's interesting to dissect this, particularly the fact that we see these people every day. We see people coming in with random diseases, things that they hadn't expressed. We're seeing cancers that are flaring up, and breast cancers that are related to viral patterns. You look at the research that's out there now, there's a lot of finger pointing that's there. I want to go back to the blood testing, springboard off the lymphocyte count that you made. So if you do a white blood cell count, right, and do a red blood cell count and the subfractions, that's called a complete blood count, the CBC. And
differential, yeah.
With the differentials, right? So when we talk about white blood cell count, that means a total of these white cell protective mechanisms that are in the system. Then the subfractions, the neutrophils, the lymphocytes, the monocytes, the basophils, the eosinophils, these guys have different, if you will, functional capacities within the body. It's a whole lot like saying money, white blood cell, and it has value. Well, these have capacity and function. So, but what we're seeing is that the laboratory values are shifting, and my brain goes, why are they shifting? Are they trying to make themselves right? For example, monocyte levels, and people will recognize monocytes from the old terminology of mononucleosis. And that's where they get the term. When that mononucleosis is diagnosed is because the monocyte level goes through the ceiling. And what we're noticing now is that the parameters of what is normal for the monocyte expand. So why does that have anything to do with what we're talking about and the viral loads that were there? Any viral load, particularly Epstein-Barr virus, which is a cousin, a sister, twin of the monovirus, but also with the COVID and so forth, they start rising and you start seeing shifts in the neutrophils and the lymphocytes. Scott, is this by accident or is this on purpose?
I think it's probably on purpose. I think the other thing we really haven't talked about is autoimmune. And this is going to also affect your autoimmune diseases. And I think there's been a correlation between Epstein-Barr and like Hashimoto's and rheumatoid arthritis and some of these other things. And those seems to be on the rise too. It's an interesting thing. I think when they do these laboratory elements, they'll look at every quarter, they'll take a portion of the population, 600 people or whatever, and they'll arbitrarily say these numbers and grab them and then look at them and say, okay, this is our new numbers that we look in this particular region. They'll do it regionally. I think you've seen this if you use the example of cholesterol, for example. I think in the past, and you got a little more age on me, but but the thing is I think at one time, didn't you see it was at 220 or 240? And sometimes it was a total, but now you get so many people on statin drugs that now artificially it starts bringing the number down. I see things that occasionally, I think of LabCorp, I think I've seen one time there was 180 was actually considered normal for the cholesterol, and it's going to still be driven down. And there's problems when your cholesterol drops too low. There is a reason, there are some healthy aspects to that.
Well, that's the whole piece. You're starting to see why do they come. When I was in school back in the day when the dinosaurs ruled the earth, normal cholesterol is 225, and the LDL, supposedly the bad guys, the normal level was about 120, 125, and the HDL levels, wanted to be, if you wanted to have them nice and strong, for a guy they should be in the high 50s, a woman should be 75 to 80. And now you're seeing shifts across the board, as you say, and these guys want to put people on statins, dropping these levels way down for what? I don't know. Standard of care. They're putting everybody on aspirins and this and that when there's better ways of controlling it, and they don't get it. Then you get somebody that goes in for surgery that's on, for example, an omega-3. Somebody that goes in for surgery, they have a little bit of a low level of vitamin E. They go in, they have a little bit of chlorophyll. And these guys are freaking out because they're saying, well, this is going to thin the blood too much, right? So what do? They take them off of everything, and then they put them on artificial blood thinners. And it's like, why are you doing that when those things have side effects and the other guys have minimal problems across the board? So we're seeing these things that don't make any sense until you ask the question, where do they come from? And, if we want to keep the immune systems nice and strong, we want to keep things solid, you've got to make sure that your intestinal system is locked in as well. And it's the microbiome, the good bacteria is there, the bad guys aren't there. And, you and I deal with that type of thing on an ongoing basis. Why isn't, and I'm obviously going to the back door, an immune response, why is that immune system so dependent on good microflora?
Well, microflora, the thing is also dependence on, I think, again, I go back to the cell membrane aspect. The microflora actually takes things like vitamins and things like that, breaks it down for us. The microflora actually gives us, makes the environment for the large intestine appropriate for actually growing good bacteria. It's the microflora is in that particular regard, short chain fatty acids are important for actually making a good pH in that level there. And so the bacteria is just a huge, huge element that also, and it's even like you think about it, like our skin, we got barriers in our body, with the barriers of our skin, and we've got a barrier around the respiratory area and our digestive tract and the blood-brain barrier. We've got bacteria in our hands that will actually be beneficial to protect us. There's the old thing of the hygiene hypothesis, what's happening in the hospital nowadays. We have to kind of balance things a little bit more with nature, because if we try to wipe everything out, those smaller, not as strong bacteria eat a certain amount of niche of the food supply You take that out, and all that's left to eat that niche of food supply is going to be the real bad guys, MRSA, C. diff, and things like that. So, like the number one death, the why people die in the hospital is what? They die from infection. And so they're now trying to do is like, look at the turnaround times for knee surgeries and hip surgeries. You're in and out. They don't want to have you the risk of the possibly getting it because they're loaded with that and they're constantly fighting it, but they don't really can constantly kill these things because they're super bugs.
Yeah,
So, yeah, go ahead.
Number one.
So they're super bugs. So I think one of the things is that, we got to kind of make sense of some of these things and not have everything supervised sterile. I mean, I walked in and saw a friend of mine who was up in Leesburg, and I kept looking at like how many different sterile things can I come across and spray my hands with and rub down. There's a certain point that we need to have some balance, and I think that's another thing. Going back, I think when I originally talked about, we want to have an immune system and we have to challenge it. We have to work it. We have to have some things that challenge us to make it strengthen it. You got to have some exposure to have some strengthening. If you don't do anything, you lock yourself in the closet, you put yourself in a mask, you go to the adrenal. We don't even talk about the stress mechanism of this. And all of a sudden now we're more and more susceptible because we don't understand why. We're just messing with the natural balance of things.
There's an interesting article that I read. I can't remember how many years ago it was now that it put a smile on my face. I laughed like crazy because, teachers who are kindergarten teachers and preschool teachers and like that, they're being exposed to all these little petri dishes called children, right? And what they did is they followed a group of teachers for about 10 years that taught primary school levels. And what they saw is that these teachers who were exposed to all of this nonsense, and when they first went into the teaching arena, they came down with the colds and the sniffles, and they felt lousy. But over time, they had stronger immune responses, given that everything else was in a normal pattern. The study came out of Europe, by the way, than other people who had not been repetitively exposed. So that goes to your primary or your innate immune system. You're exposed to these things, and it has the God-given ability to protect you. And those are the things that we have to remember. If we isolate ourselves, we have no immune response. That's, what's the old statement that, a kid should eat a pound of dirt before he's 5 years old or a year old or something like that.
Yeah. Well, 5-second rule, 5-minute rule. What the hell?
Exactly. The other day we were at the office and somebody dropped something on the floor in the kitchen, and I picked it up and I did it just to aggravate people like I do periodically. And I popped it in my mouth and everybody looked at me and said, "Oh my God, you actually did that?" I said, "Of course I did. There's nothing down there. There's no big deal. There's more garbage on this table right now than there was on the floor, but it hadn't hit the ground for more than 5 seconds. I nailed it, but it was one of those things."
Look at the things too. Is something like the C-section situation. Like where's like a baby's born with a sterile gut? Well, if it goes to the vaginal canal, it really doesn't, because what happens, it picks up the bacteria that mom has along the vaginal tract and actually goes into the mouth. And since the babies are connected by the umbilical cord, gets the immunity from the mother for those bacteria. What happens in the C-section?
Yeah, it's gone. It's not there.
It's gone. So in Canada, they're doing vaginal wipes and smearing on the child to try to see if you get some of that effect.
Yeah, and if you talk about immunological responses in newborns, you go to the animal world, and the stimulation of the genitalia also increases immunological and neurological reactions. That's one of the reasons that a child should go to the breast with a mother for nursing. But that's another story, and we'll have some other folks who have a greater bandwidth in that area than I do on the program, and we'll talk about that in a pediatric application. But it's true, Scott. If you were going to make some recommendations for our listeners, to really protect themselves this winter, and what would you tell them to do? How would you say, listen, if you were my family, if you were my kids, this is what you would do?
Well, I think the first thing is he's going to look at some of the things that are extremely important for our immune system, and you're going to start with things like vitamin D. And you're going to take vitamin D, and since it's like now we have less light, you might have to go up to about 10,000 independent units to get the information that or the balance and the protection that comes off of that. Zinc is an extremely important element that needs to come in, as we call it, like getting that into the cell, getting it and killing viruses and things of that nature. And there's so many different things associated with that. And zinc also, there's some things there with zinc that kind of stimulates the thymus gland. Vitamin A. You look at vitamin A because around, again, there's their barrier, this mucus barrier around the respiratory system and the digestive system, and vitamin A plays a huge part with that. Helps with the sinuses and the respiratory centers of the body. It's mucosal aspects, helps makes antibodies for the body. Vitamin E, antioxidant, helps with doing some of those elements, protects the lipid membrane. We're talking about that membrane that separates that. Essential fatty acids are important because that makes the membranes of the kind of these cellular walls where things have to translate through. Remember, this virus has to go through that wall to have that challenge. And a lot of times we're doing things, either foods or herbals or whatever we're trying to do, we're trying to get across the membrane barrier, and we want to make sure it's a healthy one. So that's another one aspect associated with that. Selenium is going to be another one you can add to it, and protects against inflammation, helps with something called glutathione, which is your major antioxidant. It helps with free radical formation that's in the liver, and it also protects the lipids also. And you can do things even like garlic, has a very strong protein, is number one of the things that are killing off bacteria. It's important.
Garlic is allicin. You know, I never thought that I would be giving my patients thing my grandmother gave me when I was young. Any type of cold or flu, she'd go downstairs and pluck the garlic off that she used to have it hanging in the cellar. She'd come downstairs and said, "Here, chew this up." And you look at it, "Leave me alone." She says, "Chew it up," and she'd never leave you. But you got over it real quick.
Yeah, well, like this morning, I've already had let's say I have a thing of minced garlic. I just take a little spoonful of it every day, and it's off the refrigerator door and take a little bit, and also I keep other people away from me too. So
yeah, I was going to say, what do your patients say, Scott?
But I mean, there's a lot of different things. I mean, those are some major important ones. I think olive leaf extract, another one's an antiviral. You'll find a lot of those. Quercetin, there's some other things that are there that are very important. For that to work correctly. And, and also there's also different things, that little tools of the trade you can do. There's the thumping or tapping of your thymus that seems to stimulate some things too. There's over 100 enzymes that can be affected by the thymus, which helps, it's pretty much an immune firehouse.
It's a T cell production, and it works for cancers. It works for all kinds of viral patterns and components. The thing that people really have to understand is that they have everything that they need, providing that they pay attention to it. I mean, I've put patients, when the patient gets sick and they have a viral load, sometimes I'll put them on 50,000 units of D for 5 to 7 days, dropping it down a little bit and keeping them on there. But you got to look at diet, you've got to look at your environment, you've got to look at your stress levels, you have to look at all those pieces. It's an ongoing process that we are responsible for, and we have to pay attention. Scott, we're going to kind of wrap up in a second, but I want to ask you one question. We've got about a minute, and is there anything specific that you would tell somebody not to do going forward? About 30 seconds, buddy.
Oh, geez. Not to do. I think it's easier to say to do some things. Not to do is not to stay away. You got to move. Being held up in place. That's one of the things. There's a line they say once in a while. It's like, do you want to be a cesspool or you want to be a moving river? I'd like to put the moving river. Stagnation grows bad things, and when we don't move, things happen. There's a lot of different things that happen. Cardiovascular benefit, things like that. But you got to move, and we didn't even talk about the lymph system and how the lymph nodes can shrink down. You need to get that stuff pumping, and so to do that, just move it. What? Go ahead.
Anyway, I'd like to invite everybody to the class on this Wednesday evening, the 10th, at the Roselle Center for Healing. Please join us. Dr. Scott and I will continue the process of going back and forth. This has been great. Scott, thank you for being my guest.
Thanks, Tom. Yeah.
I'll see you tomorrow. Bye.
All right. Bye.